Very good afternoon, good morning to all the participants and the respected judges. I am Krishna Kumar Bharti, student of B Farm fourth year from Assam Downtown University. Let me share my screen first, please. Is my the screen is visible?
Yes, your screen is visible.
Okay, so topic of my poster presentation is empowering health through innovation, the pharmacist role in transformative healthcare. So as we all know that the importance of pharmacy in our day-to-day life and healthcare also, pharmacy play a very important role. In general way, we can say that pharmacy is a place where we can get the medicines and personalized healthcare with the help of the pharmacist. And pharmacist ensure the safe medication use and manage chronic conditions, prevent errors, and promote health awareness. So I'll be talking about the some key points of the evolution of pharmacy. Actually, pharmacy begins with the ancient herbal remedies and evolved through early pharmacopoeias in Mesopotamia, Egypt, and Greece. Also, following these trends, the Islamic Golden Age introduced the standalone pharmacies, and the industrial evolution, advanced drug discovery, and education come in this age. And the 20th century brought the antibiotics, vaccine, and regulations. And today, pharmacy integrates various technology and personalized care, which makes the pharmacist to play or contribute a very vital role in global health. So the next part is the innovation in pharmacy. So there are some few innovations. I need to focus on that. The first of all, the digital health. As I have seen from the start, several participants talk about some wearable devices. So digital health mostly deals with this. It enables real-time monitoring and management of patient health through various apps and wearable devices like smart bands and all these things. And also AI is there, which assist in drug discovery and predict drug interactions and analyze patient data for the better treatment and outcomes. E-prescription is there. E-prescription is an important part, like as we can say that it reduces the error while prescribing medications, and it helps the doctor as well as pharmacist to analyze the patient medication history and to provide the and drug interaction to provide correct medications. Telepharmacy is also there, which expand the access of the pharmacy service to remote areas. Like we can there's nowadays there are several apps are there through which we can consult the doctor or a pharmacist to online, and we can order the medications to online. So the role of pharmacist in health promotion and prevention. So pharmacists play a very important role by educating the patient about the disease preventions and lifestyle modifications, and also making the patient understood about the importance of vaccination. They actively participate in health awareness campaigns and provide guidance and managing risk and how to take medicines and all these things. So the future, if I talk about the future of the pharmacy, so there is a pharmacogenomics. So as I heard the term like personalized medicines. So with the help of in the future, with the help of this pharmacogenomics, we can give personalized medicine according to the genetic profile of a particular or individual patient. Since this is still a concept, and but the various and several challenges are there. Like it requires advanced training for pharmacists and significant investment in genetic testing infrastructure. And India, as per my knowledge, is still it is not available till now. And the robotics in pharmacy, which automates dispensing processes, improving accuracy and efficiency, while freeing pharmacists to focus on patient care. But some challenges are there, which is a high cost implementation, and there are some potential resistance to adapting new technology. Now, I would like to conclude my presentation. That is, pharmacy has become a vital part of modern healthcare, with pharmacists playing a key role in improving patient care and addressing global health challenges. Innovations like artificial intelligence, telepharmacy, and individualized medicine are expanding the pharmacist's role, enabling more personalized and effective care by contributing to public health, chronic disease management, and medications therapy. Pharmacists connect technology with patient-centered care as they address issues like antimicrobial resistance and healthcare disparities. It remains essential for pharmacists to uphold ethical principles and humanism while driving innovations to the safe future of healthcare. That's all from my side. Thank you.
Thank you, Krishna Kumar Bharti. Now, I would request members, judges, and participants, please move on with the questions. If there are any questions, you can put it in the chat box or either open your mic and ask.
Hello. Hi, Krishna Kumar Bharti.
Yes, sir.
Hi, Krishna Kumar. So,
Yes, sir.
can you, in addition to the pharmacogenomics, like you mentioned, to provide or personalized medicines, what other factors can be considered? What do you think to provide the personalized medicines to patients?
Sir, sorry, sir, can you repeat the question?
In addition to the pharmacogenomics, you have put on your slides, right, under the future of
Yes, sir.
pharmacy. So, what other factors can be considered in addition to the genetic infrastructure or genetic study of the patients? What other parameters can be like set or thought of while personalizing the medicines for patients?
So, in pharmacogenomics, while personalizing medicine or personalizing care to the patient, several factors are there, like which we can consider, like in general, age and gender, drug interaction, and environmental factors are also there, like someone is uh, habituated to smoking, alcohol. These factors we can consider, and also some health conditions like chronic health conditions, like someone is having liver disease or kidney dysfunctions. So these factors we can consider while giving personalized medicine to any person.
Okay.
Do we have more questions on the board? Okay, then thank you, Dhanush Kumar. Sorry, thank you, Krishna Bharati. Now let's move on to the next
Thank you.
participant. Uh, I will call upon Dhanush Kumar to present his poster. Dhanush Kumar.
Yes, sir. Am I audible?
Yes, you are audible.
Okay, sir. Is my screen visible?
No, not yet.
Sir?
Would you please share it again?
Yes, sir.
Dhanush Kumar, would you please share it again because it's not visible.
Sorry, sir. Just a minute. Is it visible now?
No, it's not visible yet.
Yes, now it's perfect, Dhanush.
Okay, sir. Okay, ma'am. A pleasant morning to all. I am Dhanush Kumar from Jaya College of Biomedical Science, College of Pharmacy, Tamil Nadu, India. I am here to present a poster on the topic from apothecary to a the transformational journey and future of pharmacist in innovative care and empowering health. First of all, apothecaries. Apothecaries are the ancient people who prepare and dispense medicine using herbals and natural ingredients. Uh, these now the apothecaries are replaced by the pharmacist evolved. Sorry. Is this visible?
No, it's not visible.
Sorry, sir. Just a minute. Now, sir.
Yes, it's visible.
Sir. Then we come to the Empowering Health, the legacy of pharmacist. The pharmacist as a god of medicine safeguards the drug prescription preparation and dispensing, transition from apothecaries to modern pharmacists. Awareness of innovations, discovery of morphine and other drugs were developed from apothecary to now. Advocates of public health, immunization and health screenings, community supports and integrators of technology and science. I have mentioned here the innovative care and some historical milestones of innovative care, right from apothecaries to AI. In
The
seven,
screen is still not visible.
not visible.
Yeah.
Or which, yeah.
Now it's visible.
It's visible now. You can go ahead.
Okay. In the topic of innovative care, I have mentioned some milestones of the innovative care, right from apothecaries to AI now. 1754, the establishment of first apothecary shops in the Baghdad, formalizing the practice of pharmacy. This is the first ever apothecary shops in our world. And then in 1805, there was isolation of morphine by Friedrich Sertiner, making the beginning of modern drug discovery. In 1928, discovery of penicillin by Alexander Fleming, revolutionary infection treatment. In 1970, emergence of clinical pharmacy focusing on patient-centered care and medication therapy management. And now the AI comes in a role as a pharmacist. In 2021, the integration of AI, robotic systems, and pharmacogenomics transforms the personalized medicine and drug dispensing. A recent innovation is insulin inhaler from Cifla. Afrisa is a rapid-acting insulin delivered through the inhaler, dissolves rapidly upon the oral inhalation upon lungs, and delivers insulin quickly in the bloodstream. The future of pharmacy and key trends now were expanding role in patient care, chronic disease management, preventive care. The clinical pharmacists have a role on this chronic disease management and preventive collaborative health cares. The emphasis of personalized medicine, pharmacogenomics, a study of genetic basics variation in drug response will helps in personalized healthcare system. The leadership in public and educating the education and training of the pharmacists have now developed a lot using AI like ChatGPT and other resources. I conclude this by the transformation journey of the pharmacists reflect the legacy of innovation and resilience. Thank you, sir.
Thank you, Dhanush Kumar.
This is my first ever poster presentation. If I made any mistake, please let me know about it and I could correct myself in future.
Yes, definitely, Dhanush Kumar. Now we will move to our judges for their suggestions and remarks and for the questions also. Judges, participant, are there any questions? Okay, then I will consider it as no. So I would request Dhanush Kumar to please stop sharing his screen. So we can move to the next participant.
Yes, sir.
Thank you, Dhanush Kumar. Now let's move on to the next participant, Amanji Vaishnavi. I would like to call Vaishnavi on the board, please.
Yes, sir.
Share your screen, Vaishnavi, and you can start.
Okay, sir.
Hi Bharat. In my Excel sheet, different name is showing Rituja. It is showing on Rituja.
Yes, sir. Rutuja is the next participant. Actually, we have set up the participants according to the availability
Hello,
of them.
sir.
Okay, okay.
Yes, Vaishnavi, you can go on.
Okay, sir. Is my screen visible, sir?
Yes, your screen is visible.
Okay, sir. First of all, good morning, sir. I'm Vaishnavi Amanchi from Sarojini Naidu Vanitha Pharmacy Mahavidyalaya, Hyderabad. I would like to present about the milestone of healthcare, that is pharmacy, which provide great guidance on the safe and effective use of drugs, mainly by the 3D printing technology in pharmacy, which become a standard in personalized medicine. If the barriers such as material compatibility, scalability, and cost of technology and regulatory approval are addressed, 3D printed pills may become as standard in personalized medicine, which are manufactured and delivered. Coming to materials used in the 3D printing must be safe, FDA approved, biocompatible, and capable of incorporating APIs without altering their efficacy. And other materials used in 3D printing, such as nanomaterials, natural biopolymers, etc. And then we focus on the methods such as inkjet printing, fused deposition modeling, binder jetting, stereolithography, selective laser sintering, extraction based printing, etc. These each and every method is important to get medicine. And then 3D printing technology have proved the ability to create dosage forms, allow the combination of one or more drugs within the same solid dosage form to improve patient compliance style and disease profile. And I want to explain that in traditional method, customization is often limited and can be expensive, especially for small guns. Producing complex shapes may require specialized tools or molds. And then compared to 3D printing, in 3D printing, highly customizable, enabling the creation of complex shape and design that are difficult in traditional methods. Changes to the design can be made quickly without changing the manufacturing process. And I would like to conclude that pharmacists play a vital role in the implementation of 3D printing technology in healthcare, particularly in the production of personalized medicine. This is the end. Thank you so much, sir, for giving this opportunity.
Thank you, Vaishnavi. Now, I would like to ask judges if they have any suggestions or doubts and questions for all.
Varad, nothing from my side.
Okay, sir. Participants, CC members, and other respected judges, any questions?
Just one question from me.
Yes, sir.
So, can you put some light on the costing of this 3D printing and how it can be like accessible to the larger population? What are the impacts of cost? Yeah.
Sir, can you repeat these questions once again, sir?
Can you put some light on how the cost effectiveness compared to the conventional methods with this 3D printing technology? Like from cost economic perspective, I'm asking.
Economic perspective,
Is it economic compared to the conventional formulations that we have? Or what are the impacts of cost?
impact of cost, it depends upon materials that we use.
Mhm.
In
Okay, fine.
sorry, sir.
No
Okay.
problem at all. Yeah.
Okay, sir. Thank you, sir.
Okay, thank you, Vaishnavi. Thank you, Vaishnavi. Now, I would like to ask you to please stop sharing your screen.
Okay, sir.
Thank you. Now, next on the board is, sorry, sir. Now, next on the board is Rutuja Malusare. I will request Rutuja, please share your screen and you can go with your presentation. Yes, Rutuja, are you available? Okay, I think she is not available. Now, next on the board, so we can call Vashishta and Hasni. Is Vashishta and Hasni present?
Yes, sir.
Yes, you can start your presentation.
Sir, is it visible and am I audible?
Yes, this is visible and you're audible too.
Okay, thank you. Good afternoon, everyone. I'm Vikshita and my friend Hasini. Today we are here from Sarojini Naidu Vanita Pharmacy Mahavidyalaya, and we are presenting our poster on the topic polycystic ovary syndrome and integrative approaches to management. Okay, PCOS is one of the most prevalent endocrine metabolic disorders, affecting up to 80% of the reproductive aged women worldwide. It results from the combination of genetic, hormonal, and environmental factors, leading to irregular cycles, insulin resistance, acne, and challenges with weight and fertility. Our poster explores a holistic approach to manage PCOS by combining diet, exercise, innovative therapies, as well as patient education.
Now, let us see the clinical manifestations of PCOS. PCOS symptoms are diverse and they include hair loss, acne and other skin problems, rapid weight gain, excessive cramping, bloating during the menstruation, irregular periods, fluid-filled sacs, etc. Now, let us see the effective diet regimens of the PCOS to be followed. As nutrition plays a central role in the PCOS management, we include 4 dietary approaches. Those are low glycemic index foods, Mediterranean diet, low carb diet, intermittent fasting diet. Intermittent fasting diet is a 16:8 method. Coming to the low glycemic index foods, these helps in regulating the blood sugar levels, which include whole grains, non-starchy veggies, legumes, fruits, nuts and seeds, etc. Mediterranean diet, focusing on healthy fats and leafy greens. Examples of such foods are healthy fats, leafy greens, whole grains, lean proteins, nuts and seeds, etc. Low carb diet. Low carb diet is beneficial for improving the insulin resistance with options like high quality proteins and low carb foods. Examples of such foods are non-starchy veggies, healthy fats, low carb fruits, etc. Intermittent fasting is a 16:8 method where 16 hours is fasting period and 8 hours is eating window. The examples to be followed are balanced meals, hydrate, and healthy fats. The foods we should not consume strictly for PCOS are refined grains, sugary foods and drinks, fried and processed foods, high carb foods, excessive sugars, additional sugars, etc. Now, let us see a case study approach. A 30-year-old woman with severe PCOS improved significantly through a low GI diet and regular exercise after limited medical medication success. In 6 months, she lost 10 kgs, regained regular cycles, reduced acne, and improved insulin sensitivity, allowing her to stop metformin. Within 8 months, she conceived naturally, highlighting the effectiveness of lifestyle changes in the managing PCOS. As we can see that rather than following the therapeutic regimens, it is really important to follow a good diet.
So now let us say about the recent clinical trials and studies that are being taking place for the treatment of PCOS. In that first one is Biomed clinical trial. It is a combination of spironolactone, pioglitazone, and metformin to address insulin resistance, androgen excess, and ovulation in PCOS. It is a synergistic multi-target therapy for replacing monotherapies, and it's also one of the novel therapy system. And next one is myoinositol and D-chiro-inositol therapy. It involves natural components improving ovulation, for reducing insulin resistance and balancing hormones. It is a safer and non-pharmacological alternative to traditional treatments. Next is stem cell derived treatments. University of Chicago Medicine explores extracellular vesicle therapy to restore ovarian function, offering new hope for PCOS related infertility. Now, let us see a case study where stem cell derived therapy have proven to be successful. A woman with resistant PCOS underwent treatment using stem cell derived extracellular vesicles. This therapy improved ovarian function by addressing cellular level dysfunction, reducing inflammation and restoring hormonal balance, which leading to the enhanced fertility markers and renewed hope for severe PCOS cases.
Now, let us see an interesting AI innovation for PCOS diagnosis. So, the platforms like PCONet leverage the AI to enhance the PCOS diagnosis. In this, a healthcare provider uses the PCONet AI model to assist in diagnosing the PCOS. First, the input is given to the AI model. The AI analyzes the input which is given, which can include the patient history, clinical symptoms, hormone levels, and as well as his or her imaging results. So, based on the input provided, the AI analyzes and gives the outputs. So, a likelihood score of PCOS diagnosis is made by the model. Suggested follow-up tests or lifestyle interventions are also given by this, and risk assessment scale is also can be driven from this AI model. Now, the clinical healthcare provider combines the AI's insight with their expertise, confirm the diagnosis of the treatment plan. And the benefits of this PCONet is that it is efficacious, accurate, it gives accurate results, and it gives tailored recommendations to individual patient profiles. Coming to the perils of misusing the medications, people has found to misuse the medications. So some of them are self-medications and overuse of fertility drugs, excess use of metformin, unregulated supplements, and misuse of weight loss medications. So let us explore illegal hormone injections in food, which is a growing concern in India. In India, the use of hormone injections in food, particularly in the dairy and poultry industries, is an increasing concern. So hormones such as estrogens, testosterone, and other growth-promoting steroids are sometimes used in livestock farming to enhance the growth and increase the milk production. Consuming these contaminated foods can disrupt the natural hormone balance, and potentially it leads to conditions like PCOS.
Now let us see how to avoid hormone-laden foods in India. We can do it by opting organic and hormone-free meat and dairy, selection of pasteurized, raised, and free-range animal products such as free-range eggs and chicken and grass-fed dairy, eating more plant-based foods such as lentils, beans, vegetables, whole grain, and opting for a plant-based milk such as almond milk, soy milk, coconut milk, etc. And by avoiding highly processed and packaged foods, by opting natural meals like home-cooked meals with natural ingredients instead of relying on fast food or packaged products because it might disrupt the hormonal balance. Supporting local and sustainable farming because local farmers are likely to avoid illegal hormones and growth promoters, and washing the peel produce thoroughly before consumption or buying organic produce whenever it is possible.
Healing PCOS, metabolism and weight balance are essential steps in managing the PCOS. Some steps to be taken for preventing or managing the PCOS are controlling blood sugar levels, exercising properly, lifting low weights and lower carb diet, controlling sugar and intake, and also considering gluten and dairy-free diets, etc. Now, let us dive into an interesting case study. Nicole's journey embracing PCOS with self-love. Nicole, diagnosed with PCOS at the age of 14, he struggled with symptoms like acne, irregular cycles, and weight gain. Despite early challenges with the medications, she found inspiration on social media, particularly from Harna Scout, who promotes self care and acceptance. Nicole started small lifestyle changes like walking breaks and fitness classes, losing 10 pounds and gradually embracing her self love, and improved management of her PCOS symptoms.
In conclusion, we interpret that in managing PCOS, most of the people are opting for potentially harmful therapies which have severe side effects. But with the minor changes in the lifestyle modifications such as diet, exercises, etc., are proven effective for symptom management by reducing the risk of adverse effects. Also, avoidance of illegal hormone-laden foods and emphasizing safe, nutritious, and natural food choices can play a pivotal role in supporting hormone balance as well as the overall health.
References are from Wiley Online Library, U Chicago Medicine, UCSF Clinical Trials, National Library of Medicine.
Thank you for your attention. We are happy to answer your question and discuss it further. Thank you.
Thank you, both of you. Now I request all to go with the questions and discussion.
Hi, Varad. Hi, guys. First of all, it's really interesting topic.
Thank you, sir.
Congratulations to you, and it's like your poster is also very concise and very knowledgeable. So, can you scroll down a little bit because I have a lot of questions.
Okay, sir. Thank you.
So you have mentioned Wiley library and this type of references. Whenever you are putting this references, it should be like very scientific form. Either you can use AMS style Chicago, or like
Okay.
it's like a publisher, right? We
Okay,
are
sir.
not able to mention their website. We have to provide our evidence, which
Okay.
like issue, which author it has been, where you have referred this details, right?
Okay,
So
sir.
whenever you use Chicago, AMS style, Vancouver, whatever you want, you can use. Like
Okay.
Chicago medicine, this is also type of library or might be a university. I'm not aware about this.
Okay.
Other, yes, national library. You have to mention the links as well. So this
Okay,
is
sir.
the feedback for reference. Now
Okay.
I have a questions. You have
Yes.
mentioned these low calorie diet, low carb diet helps, but
Yes, sir.
low carb diet have a very in long term it's had very drawback in our body. Like for example, hormone disturbance is also happened, and people is also doing low carb diet without knowing how much calorie they have to depreciate. Like for example, if person weight is around 65, then the person calorie intake might be 2200, then they are doing very low calorie deficit, and they are like cut all the carb in our body is like a fuel. Without fuel, body can't run. So the body, instead of glycogenesis process, body enter in like a different process, like they are using ketogenesis process. So once the body enter in ketogenesis process, body automatically create the imbalance of hormones. So this is the one more biggest drawback for low carb diet. I understand like these are studies has happened, publications is also happening, but the thing is other side people. For example, I am also against the low carb diet. Okay, because I'm against low carb diet because we have published the recently a meta analysis where we have proved that low carb diet is very dangerous as compared to keto diet. Keto diet we have like options. We can add protein, we are able to add fat and minimal quantity of nutrition. So it should be like approach. I think you have to more scroll in this domain. There are other diet plan is also there, like keto diet is also there instead of low diet, because low diet have very long term very disadvantage in our body.
Sure, sir. We will look into it soon.
Sure, sir.
Thank you.
Hi, Hasini. I have a small doubt. Oh, what treatment have better accuracy of PCO? Do you
Can
want
I
me to
answer?
speak? Yeah, sure.
Actually, for the treatment of PCOS, according to me, we can treat it with the help of basic diets as well as for the certain lifestyle changes, as we have shown certain successful case studies as well. If it is not successful, and in that cases, you can go for medicines where there are certain stem cell derived treatments and spiomet novel drug therapy medications, etc. Where these drugs are in the presence of a guidance of a doctor, these are found to be successful so far. But before going to the therapy, we say that diet as well as the little changes in our lifestyle modifications helps us to cure out from PCOS.
Okay, thank you.
Thank you.
Any more questions on the board? Okay, I consider it as no, and let's move on to the next participant. I request Vashishta to please stop sharing her screen. Yes, thank you. Now let's move on to the next participant, Abhirami Rajshekhar. I would like to call Rajshekhar on the board, please.
Yes, sir. I'm there.
Okay, thank you. Now you can share your screen and start your presentation.
Okay, sir. Is it visible now?
Yes, it's visible.
Respected dignitaries, me, myself, Abhirami Rajshekhar, PharmD intern at 8th College of Pharmaceutical Sciences, is here to do my poster presentation titled Unveiling the Innovation, a review-based enactment of precision medicine in antibiotic resistance. So first about the antibiotic resistance. So it occurs when bacteria evolve and become resistant to the effects of drugs that once killed them or inhibited their growth. Then about the precision medicine. So it is also known as a personalized medicine, which has been occurring as an approach that tailors the treatment to the individual characteristics of each patient, and it takes account into the factors such as person's genetic makeup, environment, lifestyle, and other biological factors to provide more effective and targeted therapies. The main mechanism which has been involved in this, the application of precision medicine in antibiotic resistance, is firstly about the rapid diagnostic testing, then about the phylogenetic analysis, then about the host-directed therapy, and also the genetic testing. So first about the rapid diagnostic testing. So it involves the prevalence of fast identification of bacterial infections and determine the antibiotic susceptibility of pathogens often within the hours. The main examples include the PCR, that is the polymerase chain reaction, or the MALDI, that is the matrix-assisted laser desorption, etc. Then about the phylogenetic testing. So it is mainly involved in the studying of genetic relationship between the different bacterial strains to understand their evaluation as well as the spread. The main example will be the tracking of the lineage of resistant strains and also identification of potential transmission of chains. Then third one is the host-directed therapy, which will be involving in the aim to modulate the host immune response as well as directly targeting the pathogens, which will be helpful for the boosting of the immune system and to inhibit the growth of bacteria. Then last about the genetic testing. So it will be helping to identify the specific variations, and also it can also improve the factors which will improve the response to the infection as well as the drugs in the case. Then about the benefits, the main benefits is to conserve the available antibiotics. Then the second one is to combat the antibiotic resistant infections. Then also for the proper management of treatment and also the further tailoring purposes, and also the prevention of inappropriate use of antibiotics and over usages, which will be include the under usage as well as the prolongation of hospital stay, and also the earlier identification of resistance occurrence, and also the determination of new indications. And also this lineage of activities will help to develop newer drugs in the case of further antibiotics processes. And also the limitations are firstly about the budget and the financial constraints, because in the case of this application of this precision medicine, currently it is available in the case of oncology. So here approximately annually about 2 crores is been occurring. So in the case of vast usage of antibiotics, it will be 5x times than the oncological purpose. So the budget and the financial constraints are very much there, and also the patient as well as the healthcare providers should have the knowledge in the case of usage of this precision medicine, and also in the case of complex genetic testing will be there. Then, in case of conclusion, the precision medicine offers a transformative approach to combating antibiotic resistance by personalizing treatment based on the unique genetic profiles of both the patient and the pathogen. And this targeted strategy not only improves treatment efficacy, but also helps preserve the effectiveness of existing antibiotics, ultimately contributing to the global fight against the antimicrobial resistance. So, all in all, we can say that the application of this precision medicine or this personalized medicine in antibiotic resistance will improve the antibiotic stewardship, and also it will help to reduce the current scenario of the antibiotic resistance. So I show my sincere gratitude to SCRMP and renowned judges for this wonderful opportunity to present my paper. Thank you.
Thank you. Now I would request judges and all the participants, if they have any questions, they can ask.
No questions from my side, dear. It's really interesting topic. Thank you so much.
Thank you, sir. Thank you so much.
Okay, then let's move ahead. Now, I would say, would you please stop sharing your screen? Yes, thank you. Now, I would like to call Vaibhav Kendre on the board, please.
Hello.
Yes.
Good afternoon to all of you. I would like to please share my poster which I share to you.
Doing same.
So basically, my poster is based on innovation care on empowering health, bridging the legacy and future of pharmacy. The pharmacy has a long been essential pillar of healthcare, which is a high legacy that has evolved alongside advantages and medicine and healthcare. The field is shifted from merely dispensing medicine to playing a crucial role in patient care and healthcare management. The ongoing evolution of pharmacy is driven into innovation, technological advantages, and increasing focus on patient-centered care, all which aim to empower individually to manage their health. The legacy it would contain majorly 5 pillars: personalized medicine, technological integration, medication therapy management, expand role in chronic diseases, and collaborative care. First is personalized medicine, the development of pharmacogenomics, which examines how the person's genetic makeups influence their response to drugs, how treatment protocols pharmacists are now equipped to use the genetic information to optimize the drugs, therapies, and dose, ensuring that patient receives the most effective treatment, which is the fewest side effects. Second is the technological integration. The use of technology of pharmacy has been expanded significantly from the development of digital health and AI. AI is used to improve the medication adherence and monitor patient outcomes and assist diagnosing and treatmenting conditions. For example, AI can help to predict the drug interaction and patient responses. Third is medication therapy management. Medication therapy management is a innovation practice that focuses on optimizing drug therapy and improving therapeutic outcomes through direct pharmacist-patient interaction. Fourth is the expand role of chronic disease management. Pharmacists are now more involved in managing chronic diseases such as diabetes, mellitus, and hypertension and asthma by offering continuous monitoring, patient education, and personalized counseling. With these collaboration care models, the trend towards integrated team based on healthcare delivery has also influenced the physicians, nurses, and other healthcare to connect with pharmacists. And this approach fosters communication and trust, ensuring that all aspects of a patient healthcare addresses. And then next point is innovating care and empowering health. It would contain 5: patient education, health monitoring tools, preventing health, self-care medication. Patient education, pharmacists play a vital role in education patient about their medication, potential side effect, and lifestyle changes. But they can improve their health by providing clear and conveying information. Pharmacists help patients to feel more confident in their treatment plans. Health monitoring tools with the app hearing devices and other health monitoring tools, patients now have access to the real-time data on their health. Pharmacists can leverage this data to adjust the medication, provide recommendation, and support patient in making the decisions about their health. Third is preventive health. Pharmacists are inclusively involved in the preventive care, offering screenings and health checkups. Preventive care essentially is reducing burden of chronic diseases, and pharmacies as a part of large healthcare system. It is a portion in many significant in this area. And last is self-care promotion. With the rise of self-care movements, pharmacists are guiding to patients on the safe use over-the-counter medication, supplements, and lifestyle modification by fostering independence and promoting self-practices. Pharmacists help empower patients to manage their own health and decide. Lastly, I conclude that innovative care and the improvement of health key is a key future of pharmacy, which seeks to build on the legacy while adapting to now technologies, patient needs, and healthcare role models. As pharmacists continue to expand their role behind the traditional boundaries, they will become the more integral and delivering comprehensive. So safe, economics, use the medication, but also long-term wellness, patient improvement, and healthcare outcome. By bridging the past and future of profession, pharmacy will continue more in construction in modern healthcare. Thank you.
Thank you, Weber. Now I would request judges and participants, if there are any questions, you can go ahead with the questions.
Hello, hello, Vaibhav.
Sir,
It's the
hello, sir.
same feedback. Like the poster is not sticking to the standard guidelines. So next time, please try to like put it in a standard format so we can assess it, right?
Sir, it's my first time. That's why
Yeah.
I am not able
We
to.
understand. We understand. It's not an issue. Just
Okay,
keep
thank you,
it in
sir.
mind next time. Yeah.
Okay,
Hi, Vaibhav. Good afternoon. Yes, the same feedback I also
sir.
want to give. This is your first time. It's fine.
Yes, sir.
But लाइक हम लोग का सोसाइटी का पर्पस, जैसा आई हैव मेंशन अर्लियर, हम लोग का पर्पस ये है कि आप नेक्स्ट टाइम कहीं भी जाओ या सोसाइटी में हम लोग के पास दोबारा प्रेजेंटेशन करो, कहीं भी
Yes, sir.
इंस्टीट्यूट में, इट्स योर पर्सनल कैरियर ग्रोथ ना, यही टाइम को यूटिलाइज करके वी हैव टू ग्रो और साइंटिफिक साइड और आपको एक्सप्लोर करना है। तो ये फर्स्ट टाइम अपना लर्निंग पार्ट है। नेक्स्ट टाइम आई एम एक्सपेक्टिंग फ्रॉम यू थोड़ा बहुत अच्छा प्रोफेशनल आएगा आपके साइड से पोस्टर, मतलब हम लोगों को भी आइडिया लग जाएगा ना कि कहाँ से
Yes,
क्वेश्चन
sir.
पूछ
Of
सकते हैं,
course,
क्या
of
चीज है,
course.
राइट? और
Of course, sir.
दैट्स इट डियर, थैंक यू सो मच।
Thank you, sir.
Yes, thank you, Vaibhav. Thank you, sir, for your guidance. Now let's move to the next participant. I would like to call Vaishnavi Siddham on the board, please. Vaishnavi, share your screen and you can start your presentation.
Vaishnavi, can you zoom out? It is not clear.
Yes, sir.
Little bit.
Now it's visible, sir.
Yes, it is visible.
Okay. Hello,
But
everyone.
still, I have to zoom out. No, no worries. You can start.
Vaishnavi, please speak a bit louder.
Yeah. Hello, everyone. Good afternoon to all. My name is Vaishnavi Dinesh Siddham from first year pharmacy student at Oyster Institute of Pharmacy, Sambhajinagar. Today, I'm excited to present my poster on innovating care, empowering health, the future of pharmacy. The topic is very amazing as it is explore how the pharmacy sector is evolving and to meet the changing needs of patients and healthcare system. So, at the first, let's look at the current trends like technology. Use of technology. Use of technology has a huge role in transformation. Pharmacists, for example, telefarm allows patient to consult with pharmacists remotely and have made healthcare more available and accessible. Then we are moving to the second trend, AI, artificial intelligence. It is also very helpful to providing and analysis the patient data and identify to the health diseases. Issues to provide a more enhanced quality of treatment for the patients. After that, the main community support. It allows to help everyone for better health and understand the medications provide services to the patients. Like pharmacists get involved in their communities to help everyone for a better health and understand to provide the medications and services. Then we are moving on the personalized care. It is a very essential thing because every patient have the mindset of getting a good quality treatment. So by pharmacists, it was being fulfilled. After that, we are moving on the preventing illness. It's like a safety by telling our patient or our community convey the safety measurements to prevent the diseases or to spread to everyone. Like corona, we have been seeing that scenes, and that made us to do healthy habits like yoga, get a proper meal, and the basic things that change the patient's health and make them more fit and making their immunity more stronger. After that, at the last, the working together can make sure patients get the best treatment possible. I have mentioned that the thing at every field we have to work together, and that makes our let's make more comfortable, compatible to everyone, and all that. Thank you so much.
Thank you, Vaishnavi. Now I would like to move on towards the judges and participants to feel free to ask the questions now. Respected judges and dear participants, are there any questions?
Yes, yes. Nothing from my side, but yes, a small again feedback, Vaishnavi. Uh, Instead of like putting informative type of slides, it's my suggestion because you are in first year, right? So you have to find some difficulties where pharmacy people is lacking, like billing process जो है आपने बोला डिजिटल वाली चीजें बहुत इंपॉर्टेंट है, तो बिलिंग एक चीज हो गया, लाइक अगर अपन कुछ ऐसा इम्प्लीमेंटेशन लेके आ सकते हैं, लाइक अदर कंट्री यूएस कनाडा वगैरह में क्या रहता है, राइट? दे हैव सॉफ्टवेयर जहाँ पर ड्रग का एडीआर वगैरह का भी इन्फो आ जाता है, लाइक क्या कॉम्प्लिकेशन हो सकते हैं, तो एक पेशेंट को हम ड्रग डेटे टाइम में काउंसलिंग भी कर सकते हैं, दिस टाइप ऑफ अवेयरनेस, दिस टाइप ऑफ ऐसे सिनेरियो ऐड करो आप जो डिफरेंट हो, लाइक 3D प्रिंटिंग आई सॉ 2-3 पीपल ने ऑलरेडी प्रेजेंट कर दिया, ठीक है? तो सिमिलर टाइप के टॉपिक्स जो रिपीट हो रहे हैं ना, इट्स माय सजेशन यू कैन एक्सप्लोर मोर.
Yes, sir.
ओके, एंड द थीम से भी ये आपका टॉपिक मैच नहीं हो रहा, थीम जो अपना है आप उससे देखो अपना टॉपिक भी मैच नहीं हुआ. अगर ये अपन प्योर फार्मेसी प्रैक्टिस साइड और मतलब डोमेन वाइज है, इट इज नॉट जस्टिफाइड. तो ये एक फीडबैक है, इसको आप मतलब एज अ लर्निंग लो. एंड नेक्स्ट टाइम जब भी अपन को टॉपिक जो मिलता है कॉन्फ्रेंस का, पोस्टर प्रेजेंटेशन का, दैट टाइम यू हैव टू अंडरस्टैंड कि वो टॉपिक क्या है, उसके अंदर क्या क्या टॉपिक्स आते हैं, सब टॉपिक्स क्या है, उसमें क्या कैटेगरीज हैं, देन यू हैव टू स्क्रॉल डाउन. ये बेसिक फार्मेसी फार्मेसी प्रैक्टिसेस एंड ये जो ड्रग एरर्स हैं, या फॉर एग्जांपल पेशेंट काउंसलिंग, ये चीजें कहाँ पर रह सकती हैं अगर इफ वी आर वर्किंग फॉर public health domain, if we are working for pharmacy practice related conference, if we are attending, but theme से मैच नहीं हुआ ना ये.
Yeah, sir, I will try my best for
Yes, I understand and that's why मैं appreciate कर रहा हूँ. फर्स्ट ईयर में आपने इतना बनाया, that is also big thing. And इतने सारे लोगों के सामने बात करना, that is also very huge thing. ओके, तो नेक्स्ट टाइम आई एम एक्सपेक्टिंग फ्रॉम यू, पहले आप थीम पहले अंडरस्टैंड करो, आप बस नहीं, हर किसी के लिए सेम फीडबैक है, और एक्सप्लोर करो डिफरेंट टॉपिक्स. अगर अपने टॉपिक्स रिपीट हो रहे हैं तो डेट मीन्स अपन ने उस पर एफर्ट नहीं डाला. मेरे को करेक्ट करो अगर मैं गलत बोल रहा हूँ. अगर टीम में 40 मेंबर्स हैं, इफ टॉपिक्स रिपीट हो रहे हैं, डेट मीन्स कहीं तो लैक हुआ ना अपन. वो टॉपिक्स रिपीट क्यों हो रहे हैं? अगर अपन उस पर और वर्क करते और सर्च करते उस पर और फाइंडिंग करते, तो वो टॉपिक्स रेयर रहता, रेयर, कॉमन नहीं
Yes,
निकलता
sir.
वो टॉपिक.
So I will improve myself better.
श्योर श्योर डियर. तो ये बस एक फीडबैक है, जब भी आप लोग कोई पोस्टर प्रेजेंटेशन में जाओ या कुछ भी प्लान, तो उस टॉपिक के बारे में इतना ज्यादा नॉलेज निकालो, इतना निकालो कि वो बंदा कोई उतने एफर्ट नहीं डाले. एक पर्सन कितना एफर्ट डालेगा? 1 आवर उस पर स्पेंड करेगा, आप उस पर 4 आवर स्पेंड करो ना, जिसमें आपका
Yes,
टॉपिक
sir.
रेयर निकल के चांसेस ऑटोमेटिक बढ़ जाएंगे आपके.
Yeah, sir. Thank you
ओके,
so much for your suggestions, sir.
थैंक यू.
Now I would like to call upon the next participants, the team by Bhagya and Gautami. Bhagya and Gautami, please be on the board. Share your screen and start your presentation.
Yes, sir.
Is my screen visible?
Yes, your screen is visible. Open the poster.
Yeah, Gautami, please continue.
Yeah, okay. Good afternoon, everyone. Myself, Gautami, and my teammate Bhagya from Sarojini Naidu Vanita Pharmacy Mahavidyalaya, Hyderabad. We are here discussing about role of leptin in type 2 diabetes. We all know that diabetes is a sweet disease.
Listen, Gautami and Bhagya, please open the PDF because we can't see the PDF. Or please, is there any glitch? You can stop sharing and reshare your screen.
Now,
No, it's still not visible.
can I ask my friend to share the screen?
Yes, anyone can share. No problem.
वरद, अगर वो लोगों को प्रॉब्लम है स्क्रीन शेयर में, देन यू कैन आल्सो शेयर.
Yes, you can send me too.
Yes, it is visible now.
Yes, sir. Okay. We all know that diabetes is a sweet disease, but bitter in truth. What is diabetes? It is a chronic metabolic disease that occurs when the body does not produce enough insulin or does not use it properly, resulting in high blood sugar. Diabetes are in 6 different types: type 1, type 2, essential diabetes, modi diabetes, ladder diabetes, and type 3C diabetes. In normally, health persons, the pancreas produces insulin, a hormone that helps regulate blood sugar or glucose. When you eat food, glucose enters your bloodstream. Insulin acts like a key and open the doors of your cells through insulin receptor, allowing glucose to enter and provide energy. In type 1 diabetes, the pancreas fails to produce insulin. In type 2 diabetes, the pancreas makes insulin, but the cells in the body become resistant to it. Even though insulin is present, glucose cannot effectively enter the cells. Now, now role of leptin.
Role of
Bhagya?
leptin. So, what is the role of leptin in diabetes? Leptin is released by a fat cells and binds to the leptin receptors in the brain. So, it is totally the circulation is correlated with the adiposity and the transport across the blood-brain barrier. When the leptin binds with the leptin receptors, leptin activates to its receptor and it activates a pathway called the JAK-STAT pathway. The JAK-STAT pathway is the messenger system inside the cells. A part of the receptor gets a chemical tag that is phosphorylation, which signals other proteins to step in. The that is STAT proteins. The STAT proteins carry the message from the receptor to cells nucleus to control to certain genes on or off. This total process helps to control the production of two types of signals in the brain: the hunger promoting signals and the hunger suppressing signals. Hunger promoting signals are the NPY. This makes you feel hungry, and the hunger suppressing POMC. This makes you feel full. So now in hypothalamus, leptin activates the POMC and the CART neurons, and it inhibits the NPY and AGRT neurons. This leads to the anorexia. Leptin has effect to feeding behavior, appetite, insulin glucose active axis, and the cognitive functions. So here there are two bodies. One is leptin sensitive and the one is leptin resistant. Leptin sensitive is the body the body is well responded to the leptin. Respond to the leptin. Leptin sensitive individual inhibits the insulin biosynthesis and secretion from the pancreatic beta cells. Insulin stimulates the leptin secretion from adipose tissue, and the leptin stimulates the hepatic gluconeogenesis and the hepatic insulin sensitive and the branch of vagus nerve. Here the leptin increases the glucose intake to the skeletal muscle and the heart like and brown adipose tissue. In a leptin resistant, it increases the permeability blood-brain barrier to the leptin is decreased, and despite it increases the plasma protein levels, and impaired transport of plasma protein across the blood-brain barrier is one of the causes of leptin resistance. Insufficiency of leptin signaling in the hypothalamus, this can causes the hyperglycemia and the hyperinsulinemia. And the medication is the leptin can also be a significant role in managing diabetes. Those are metformin, GLP agonists, naltrexone, and SLG2 calcitonin. Here, the mechanism of metformin. This metformin mainly acts in the liver, the liver is the body's factory which produces the glucose. And in type 2 diabetes, when the patient takes the metformin, that enters into the liver cells through a transporter called OCT1. Inside the liver cells, metformin acts on the mitochondria. It reduces the energy production to decreases the ATP and increases the AMP. The cell conserve energy, and you increase the AMP activates the enzyme called the AMPK kinase enzyme, and which stops the liver from making too much glucose. It reduces the fat and cholesterol production. Here, metformin blocks the specific steps effect of glucagon and the enzymes like FBPase. Glucagon is the hormone that signals the liver to make glucose, and FBPase, these are essential for producing glucose. And there are some injections. Injections like recombinant human leptin, myolaptate, and releptin, and leptin analog injections are pegylated obineptide and C75 PEG.
Symptoms in diabetes type 1. Polyuria. Symptoms in type 1: polyuria, fatigue, weight loss, ketoacidosis. Type 2, same like type 1 diabetes, but some difference between type 1: peripheral neuropathy, laboratory test, fasting blood glucose less than 126, hemoglobin less than 6.5%, oral glucose tolerance test less than 200, random plasma glucose less than 200 with classic symptoms. Diagnostic test: blood test for glucose level, lipid profile, kidney function test. Now the conclusion: leptin plays an important role in development and progression of type 2 diabetes mellitus.
Here I'm having an interesting example, like we are having the chocolate, dairy milk chocolate and the apple. The dairy milk chocolate consists of 15 grams of sugar and the apple consists of 22 grams of sugar. But we consider that the apple is more healthier than the chocolate. When we eat the chocolate, it directly enters into the bloodstream and it increases the sugar spikes and it produces insulin. And when it comes lower, we crave for more sugar. While in apple, it consists of 22 grams of sugar, but along with the fibers, it slowly enters into the bloodstream, and we will not crave more for sugars. Thank you.
Thank you, sir.
Thank you, Bhagya and Gautami. Now, I would request our respected judges to please ask the questions.
Hi, Varad. There is no question because it's very common topic. But small feedback here. As I mentioned earlier, like avoid these common topics in poster presentation. ठीक है? And instead of this, अगर आपको diabetes भी add करना था, so you can add latest drug जो वर्क हो रहा है डायबिटिक पेशेंट में, या कोई आपने currently कोई क्रॉस सेक्शन स्टडीज रीड करी हो जहाँ पे आपको अच्छे फाइंडिंग्स मिले हो. You can add those things as evidence and also mention those things in reference. So that will be more beneficial, I think. और वो जस्टिफाइड भी होगा, लाइक यू आर पुटिंग सम न्यू इन्फॉर्मेशन. आई एम अप्रिशिएटिंग यू, लाइक यू आर डूइंग वेरी वेल. ये आपका पोस्टर प्रेजेंट, ये पोस्टर भी अप टू द मार्क है, आउट ऑफ 100 to 100. बट प्रॉब्लम ये है ना, दिस नॉलेज like what we are expecting in poster presentation, we need something new, like जज हो या कोई भी पर्सन हो, हम लोग जो सुनने वाले हैं, हम लोग को कुछ नया सुनने मिलना चाहिए. यू कैन आल्सो एक्सपेक्टिंग द सेम ना, कुछ नया इन टर्म्स ऑफ, अगर आप कुछ ड्रग डिलीवरी के बारे में बताओ, कोई नया इनोवेशन बताओ. यू कैन आल्सो ऐड कुछ नया जो चल रहा है मार्केट में इस
Yes,
इसी
sir,
से लेके.
in with the role of leptin is important. Sir. If insulin is inhibited, the role of leptin acts that it produces more energy to the body.
नहीं डियर, मैं वो समझा, आपका पॉइंट सही है, आपने जो चीज बोली एविडेंस बेस्ड है. बट आपको ना वो चीजों को लेटेस्ट चीज बताना है, लाइक ये कंपनी ने ये ड्रग पे इनोवेशन किया, या ये टेक्नोलॉजी आ गई डायबिटीज में, समथिंग इंफॉर्मेटिव. ये तो उसका मतलब डायबिटीज से रिलेटेड चीजें हो गई ना, ये ड्रग्स है या उसका एक्शन है, एक्शन ऑफ मैकेनिज्म नहीं, कुछ इनोवेटिव चीज होनी चाहिए वो फील्ड में.
Okay, sir. Thank you.
गॉट माय पॉइंट ना. लाइक आप
Yes,
कोई
sir.
क्रॉस
Yes.
सेक्शन स्टडीज या कुछ सेवरल पेशेंट पे कोई स्टडी चल रही हो, कोई क्लिनिकल ट्रायल चल रहा हो, कुछ नया इनोवेटिव चल रहा हो, आप अगर पबमेड स्क्रॉल करोगे, जस्ट आप वहां पे डायबिटीज सर्च करो, आपको बहुत सारे लेटेस्ट आर्टिकल्स मिल जाएंगे, उनको गो थ्रू करो और आप देखो क्या फाइंडिंग्स हैं. और आप वहां पे फिल्टर आउट भी कर सकते हो, मेटा एनालिसिस आप वहां पे फिल्टर आउट कर सकते हो, क्रॉस सेक्शन स्टडीज, ऐसे स्टडीज जिसपे कुछ एविडेंस निकल के आए फ्यूचर में. दिस इज माई सजेशन. बिकॉज
Yes,
अपन
sir.
ये जो चीजें जानते हैं, लाइक जो चीजें अपन को गूगल पे मिल जाए, वो चीजें अपन क्यों फिर अननेसेसरी उस पर एफर्ट डालें. मेरा कहना यह है, यू हैव टू वर्क लेटेस्ट ट्रेंड. आप देखो बाहर के ऑथर्स लोग क्या आजकल काम कर रहे हैं, डायबिटीज में क्या लेटेस्ट टेक्नोलॉजीज आ गई हैं, क्या ड्रग यूज हो रहा है मार्केट में. दैट विल बी मोर बेनिफिशियल. और वो चीजें आप ब्रिंग करो इंडियन मार्केट में, जैसे ये पोस्टर प्रेजेंटेशन है, अगर वैसी चीज आ जाती तो सब लोगों को एक नई चीज सुनने मिलता आपके साइड से, लाइक नई इन्फो आती हम सबके पास.
Okay, sir. Thank you.
Okay,
थैंक
sir.
यू.
Thank you.
Thank you, Bhagya and Gautami. Now, I request you to stop sharing your screen. Okay, thank you. Now, I would like to call upon board Aishwarya Gowda to please start your presentation.
Good afternoon, everyone. Sir, you can share the screen.
Yes, I'm sharing the screen. Yes, is it visible?
Yes, sir.
Start.
I am Aishwarya Kumar Gowda from final year from Samarth Institute of Pharmacy, Belle. My topic is smart inhaler. The smart inhaler are commonly used in outer countries than India. What is smart inhalers? Smart inhalers are innovative technology enabled inhalers that track and monitor a patient inhalation technique, dose delivery, and adherence to the treatment plan. It is used in the treatment of asthma, chronic obstructive pulmonary disease, and fibrosis. Process of smart inhaler, inhaler. There are various steps. First step is inhalation. The patient inhales the medication through the inhaler. Second, the sensor data collection. The sensor track the parameters such as inhalation flow rate, volume, duration. Then third process is data processing. Microcontroller processes sensor data and calculates the metrics such as inhalation technique score, dose delivery accuracy, adherence to treatment plan. And then finally, data transmission. The communication module transmits data to mobile app or cloud-based server. Then the feedback and analytical. The mobile app provides the patient with personalized feedback on inhalation, adherence, and tracking information. Benefits of smart inhaler: improve patient adherence, optimized inhalation, better disease management, increase patient safety, cost effective. The disadvantages of smart inhaler are mainly costly. It is costly in India comparatively than other countries. Increases the complexity due to patient compliance, dependence on technology, and patient engagement.
One second. Medha, please mute your mic.
Mute yourself. Okay, Ashwar, you can continue.
Examples of smart inhalers are Edurium Smart Turbo, Propeller Health Bizeller, Teva Digi inhalers. Thank you so.
Thank you, Ashwarya. Now, I would like to call judges and participants for their questions and suggestions.
Hi, Aishwarya. I'm audible, Aishwarya?
Yes, sir.
Yes, sir, you're audible.
तो ऐश्वर्या, अब आप मेरे को ये बताओ, जैसे आपने ये मेंशन किया लाइक दिस इज द सिनेरियो आउटसाइड द इंडिया एंड यू आल्सो मेंशन द डिसएडवांटेज। जैसा मैंने बोला कि ये डिजिटल जो भी हेल्थ केयर एसेट हैं ये सब बहुत एक्सपेंसिव है इंडिया में अभी, और अपने नियर बाई नेबर कंट्रीज में ये अभी इनको अफोर्ड करना पॉसिबल नहीं है। तो आपने देखा इंडिया में ऐसी कोई स्टडी है इनको लेके, लाइक हाउ वी कैन गेट दीज डिवाइसेस इन लोअर कॉस्ट, या अपन इसका क्या अल्टरनेटिव फाइंड कर सकते हैं दीज डिवाइसेस का? और इंडिया में इसका करंट सिनेरियो क्या है? आई वांट टू नो फ्रॉम यू व्हाट इज द करंट सिनेरियो ऑफ these devices.
Till today, there is no such information about the use of smart inhalers, but this is the new technique in outer country, and it is benefit for patient to maintain their health. In India, nowadays people are engaged in their working program, so it will helpful to take maintenance of the asthma problems like asthma problem and chronic disorders. So if it comes to India, it is better for the public health.
Acha, okay, one thing. Varad, are you there? Can you please share your screen and open the PubMed, because this is the interesting topic and I am also not aware about this. So can you please open the PubMed and share your screen and just put this device name?
Okay, sir. What I have to open, sir?
Just you have to open PubMed. Just search in Google PubMed.
Okay,
I'm
sir.
putting here. PUBMED.
Just a second, sir. Is this
Yes.
the right website, sir?
Yes, yes, आप search करो उसको.
What have to search, sir?
Can you share your screen? आपने क्या mention किया था? Digital inhaler, right?
Smart inhaler.
Smart inhaler आप mention करो वहाँ पे. Search. ओके, 1 मिनट. हाँ, अभी 1 मिनट बस रुकना आप. वो 1957 वाला जो कर्सर दिख रहा है आपको, उसको एकदम 2024 पे लेके आओ. लेटेस्ट स्टडी वो लेफ्ट में. हाँ, इसको लेके आओ एकदम नियर करो उसको. 2024 की तरह और नियर. यस यस यस, स्टॉप. 1 सेकेंड. कितनी स्टडीज हैं? 57 है. 1 सेकेंड. थोड़ा स्क्रॉल डाउन करो भरत, स्क्रॉल डाउन करो. ओके, हाँ, मेटा एनालिसिस को टिक करो आप.
Sir, which one?
ऊपर लेफ्ट और स्क्रॉल करो एक बार, और ऊपर देखो लेफ्ट हैंड साइड पे लिखा हुआ है मेटा. वन मिनट. मेटा एनालिसिस कोई नहीं है. तो गाइस आप लोग चलो एक बार इसको फिर से अनटिक करो. मैं कुछ बताना चाह रहा हूँ असल में सब लोगों को. यहाँ पे ये स्टडीज का क्या वैल्यू है? ऐसे टाइप की पब्लिकेशन, ऐसे टाइप की रिसर्च अगर आप लोग करोगे इंडिया से, दैट इज यूजफुल, और आपको एन नंबर ऑफ साइटेशंस गिरने वाले हैं फ्यूचर में. आप अगर डायबिटीज पे करोगे, उसको ऑलरेडी इतना वर्क हो चुका है, कोई यूज नहीं करेगा ना साइटेशन देगा. ऐसे डिवाइसेस पे रिसर्च करने का फायदा या रिव्यू आर्टिकल लिखने का फायदा आपको ये होगा, इन फ्यूचर यू विल गेट एन नंबर ऑफ साइटेशन, लाइक ड्रास्टिकली इंक्रीज होंगे वो. थोड़ा सा स्क्रॉल डाउन करो एक बार. हाँ, एक बार सिस्टमैटिक रिव्यू पे देखो कितने हुए हैं इसमें. मेटा एनालिसिस बिल्कुल नहीं हुआ है, तो ये अभी पॉसिबल नहीं है मेटा एनालिसिस पे. सिस्टमैटिक रिव्यू कितने मिले? 17 मिले. ऐसे फिल्टर आउट कर करना है गाइस आप लोगों को। और ये मैंने इसलिए शेयर किया बिकॉज यू विल अवेयर लाइक जो स्टडीज पर वर्क नहीं हुआ, जो भी स्टडीज बिलो देन 100 है वो स्टडीज पे आप लोग वर्क करोगे, ना कि एन नंबर ऑफ लैक्स में उसके रिसर्च आ रहे हैं पबमेड पे, डायबिटीज हो गया, कोई भी सोरियासिस हो गया, विटिलिगो हो गया, ऐसे डिसीज पे यू डोंट नीड टू वर्क, ऑलरेडी वर्क चल रहा है, आपको कैसे क्रेडिट मिलेगा? आई एम क्लियर इन दिस? किसी को
Yes,
कोई
sir.
डाउट है? कोई फर्स्ट ईयर का स्टूडेंट और लास्ट ईयर स्टूडेंट, आई एम लाइक जस्ट गिविंग यू लाइक अपन को ये इन्फो होना चाहिए कि लाइक हमको किस डोमेन में वर्क करना है या हमको किस टॉपिक पे वर्क करना है। दिस इज रिगार्डिंग द टॉपिक सिलेक्शन।
सर स्पेसिफिक एक सिस्टमेटिक रिव्यू हुआ है
इस पे एक सिस्टमैटिक रिव्यू है, रिव्यू भी चेक करना है, फिर अपन को फिल्टर आउट करके रिसर्च भी देखना है। जितना कम स्टडी अपन को मिलेगा वो हमारे लिए एडवांटेज है। एडवांटेज इसलिए है बिकॉज इन फ्यूचर वो ये स्टडी पे लोग वर्क करेंगे ना तो उनको लिमिटेड आर्टिकल्स मिलेंगे गाइस। जब लिमिटेड आर्टिकल्स मिलेंगे तो आपको साइटेशन आना ही आना है 100%। सिंपल सा गेम समझो आप, अगर आपने डायबिटीज का करा तो आपसे बेटर और भी रिसर्चर है पूरे अराउंड द ग्लोब, वो लोगों के आर्टिकल लोग रेफर करेंगे और उनको साइट करेंगे, बड़े जर्नल्स में होंगे। बट आप ऐसे डोमेन को ले लोगे अभी से, आइदर यू आर स्टूडेंट डजंट मैटर, बट स्मार्ट अगर नहीं प्ले करोगे देन यू वॉन्ट गेट द साइटेशन, वो पब्लिकेशन का पर्पस ही नहीं होगा कंप्लीट, राइट? अब उसमें आर्टिकल्स ही नहीं है, फॉर एग्जांपल 10 या 12 आर्टिकल्स मिलेंगे मैक्सिमम आपको। आपका भी एक 13 नंबर का अगर कोई आर्टिकल पब्लिश हो गया बाई चांस, देन अगर कोई उसमें वर्क करता है इन फ्यूचर, कोई साइंटिस्ट या पब्लिक हेल्थ रिसर्चर उसके बारे में मोर डेटा निकालने के लिए, या कोई मेटा एनालिसिस परफॉर्म करना चाहता है फ्यूचर में या सिस्टमैटिक रिव्यू, 100% दे विल ऐड योर आर्टिकल एज वेल एज अ रेफरेंस।
Yes, sir.
तो आपका ये जो टॉपिक है, आई एम गिविंग यू लाइक आई एम वेरी इंटरेस्टेड। ऐसे टॉपिक्स को लेके गाइस आप लोग आओ और ऐसे टाइप की चीजें सर्च करो। ये पबमेड हो गया, एमबेस हो गया, ये सर्च इंजन को यूटिलाइज करो, फिल्टर आउट करो, वहां पे फाइंडिंग्स करो, नए नए क्या स्टडीज चल रहे हैं, क्या क्रॉस सेक्शन स्टडीज हैं, क्या क्लिनिकल ट्रायल्स चल रहे हैं अभी अराउंड द ग्लोब, वो चीजों को ब्रिंग करो इंडिया से इन टर्म्स ऑफ पब्लिकेशन, इन टर्म्स ऑफ कॉन्फ्रेंस प्रोसीडिंग, ये पोस्टर प्रेजेंटेशन में ये इन्फो होनी चाहिए हमारे पास। ओके, दैट्स इट भरत फ्रॉम माय साइड।
Okay, sir. Any more questions? Okay, then I will consider it as no, and let's move to the next participant. Next participant is Pratiksha Dinkar. Pratiksha Dinkar, are you on the board?
Yes, sir.
Wait, I'm sharing your presentation. Then you
Sir,
can
can you
start.
please share my screen?
Yes, doing so. Yes, is it visible?
Yes,
Yes,
sir.
sir. It's
You can start now.
Am I okay, sir? Good afternoon, everyone. Myself, Pratiksha Shashikant Dinkar. I am from Samartha Institute of Pharmacy, Belle. First of all, happy Pharmacist Day, all of you. I am here to represent my poster on Innovating Care, Empowering Health, the Pharmacist Legacy and Future of Pharmacy. This study to investigate insulin inhaler in diabetes management. As we all know, there are many types of insulin inhaler marketed already, but not every human is aware about that, especially at rural areas. Intramuscular insulin injections has been the traditional method of insulin administration for decades, but they can be a source of significant difficulties and discomfort for many patients. The process of injecting insulin into the muscle tissue can be painful, especially for those with sensitive skin or fear of needles. Moreover, the injections require a high degree of technical skills and precisions, which can be a challenges for patients with limited or visual impairment. To overcome this, all these problems that every diabetes living human suffering from last many years. For understanding, I give an example of Aprexa insulin inhaler, a revolutionary new product from Cipla that is changing the way we manage diabetes. As we all know, diabetes is a growing health concern that affects the millions of people worldwide. Insulin therapy is a crucial component of diabetes management, but traditional insulin injections can be painful, inconvenient, and also my main aim to innovate the health to urban to rural areas about diabetes management. Many healthcare professionals are aware about it, but some are not it. So let's discuss how to use it. as a pharmacist, before using insulin inhaler, read the medication first of all. Then second, understand the device. Third one is check the expiration date. Fourth one is remove the cartridge from the packaging and insert it into the inhaler. Fifth one is check the dose. Means if you prescribe the Afrexa dose in 4 units, then prefer one blue cartridge. If 8 units, then prefer one green cartridge. And if there is a 12 units, then prefer one yellow cartridge. Seventh one is inhale slowly and deeply through the mouth piece for about 2 to 3 seconds. And eighth one is breathe about slowly and gently. Then check the dose on the cartridge to ensure you have taken the correct dose, and then replace the cartridge with the new one when it is empty or expired. And also clean the device regularly to prevent normally the bacterial growth, as we all know. So it's all about the physical use of these device. But what about the pharmacological mechanism? It consists the first step, that is insulin absorption. Means it contains a powder form of a insulin that is inhaled into the lungs. The insulin is gently absorbed into the bloodstream through the alveoli, and which are the tiny air sacs in the lungs where gas exchange occurs. And the second step is a rapid absorption. Means the insulin is absorbed rapidly into the bloodstream with the peak insulin levels achieved within 15 to 16 minutes. And after inhalation, this rapid absorption allows for peak control of the blood sugar level. And third step is glucose uptake. After rapid absorption, there is a glucose uptake. That is, it stimulates the uptake of glucose by the cells, particularly in the muscles and the liver. This helps to lower blood sugar level and improve glycemic control. Then fourth step after the glucose uptake, that is a glucogen separation. Means it also suppresses the production of glucogen, that is a hormone that raises blood sugar level. And by suppressing glucogen, it helps to further lower blood sugar level. And last one is improve glycemic control. That is the rapid absorption and action of Afrexa helps to improve glycemic control, reducing the risk of hypoglycemic and hyperglycemia. Means the control of the high blood sugar in adult with type 1 and type 2 diabetes. It is used to improve glycemic control and also reduce the risk of hypoglycemia. So we can conclude that this insulin inhaler is an innovative new product that offers a convenient, also effective and safe alternative to traditional insulin injections. With its rapid absorption, reduce risk of hypoglycemia and improve glycemic control. Thank you, sir.
Thank you. Now I would like to go towards the judges for the suggestions and the questions, and then participants.
No question from my side. It's really a nice topic. Thanks, dear. Very interesting topic.
Other judges and
Thank you, sir.
participants, do you have any questions?
No questions from my side.
Okay, thank you, sir. So we would love to move towards the next participant. It is a group of two, Nandini and Kiranmay. I would like to call Nandini and Kiranmay to be on the board and present your poster.
Yes, sir.
Yeah, presenting.
1 second, sir. Is my screen is visible, sir? 1 second.
No, actually it's not.
Yes. Nandanu, is my screen visible, sir? I'm
No,
not
still
audible.
not. You can send me. I will share the screen if you have any technical issue.
Now, sir, it is visible.
No, still not.
Okay, sir. I will send you, sir, once. Sir, one of my friend will share my screen, sir.
Okay, no problem. Just do it in quick.
Yeah.
Okay, it's visible. You can continue.
Nandini, start. Good afternoon, everyone. Myself, C. Nandini, and my teammate is K. Kiranmai from SNV PMB Hyderabad. We are here to present about lupus nephritis in systemic lupus erythematosus, advances and challenges in renal management. Good afternoon, sir. I focused on lupus nephritis, which is the major complication of the SLE related to the kidney. SLE is the chronic autoimmune disease characterized by production of unusual antibodies that can attack the patient's own tissues and organs. This lupus nephritis is the abnormal immune deposition in the kidney cells and leads to kidney inflammation, which is the most complicated, serious complication of this disease. People with this problem may develop kidney damage, which leads to kidney failure, and the patient need to undergo dialysis or kidney transplantation. Mainly in this SLE disease, the factors like UV, genetic mutation, viral will leads to increase the number of the cells undergo apoptosis. They leads to release nucleic antigens and interferons. Uptaking of antigens by the dendritic cells and dendritic cell maturation takes place. This leads to antigen presentation and pro-inflammatory cytokine secretion. Lead to activation of T cells and B cells. Further immune complex formation takes place, complement fixation on the immune complexes. This leads to tissue destruction, and major complications are lupus nephritis, cutaneous lesion, and glomerular nephritis, dermatitis. These are the complications by the SLE. This immune complexes leads to damage of the kidney and leads to kidney failure. And the symptoms are carried out by my teammate Nandini.
Nandini, your voice is not clear.
Now, sir, am I audible?
Yeah, it's clear now. Yes, yes.
Okay. And the common symptoms are fatigue, headache, ulcers, butterfly rash, joint pain, hair loss, etc. Diagnosis of lupus nephritis are anti-nuclear antibody test, anti-dsDNA antibody test, complete blood count, C-reactive protein test, kidney biopsy, urine analysis, and the clinical features of lupus nephritis are proteinuria, hypertension, hematuria, renal insufficiency or failure, and edema. And the treatment of lupus nephritis mainly aims to reduce the inflammation, control the symptoms, and prevent the progenesis of the progressiveness to the kidney failure. In management, they mainly use the immunosuppressive therapy, renal protection, anti-malarials, kidney dialysis, etc. I want to the drugs used in this treatment are prednisolone, mycophenolate methylcycline, cyclosporamide, tacrolimus, hydrochloroquine are the drugs. I want to focus on the drug which mainly approved recently. Belimumab is the drug under the brand name Benista is approved in March 9th of 2011 for the treatment of lupus nephritis, approved by the FDA. In December 2020, received a new approval of the drug for the lupus nephritis. This drug is used along with the combination of other drugs like hydrochloroquine, mycophenolate methylcycline. And the main in normal lupus patient, the myeloid in mechanism, the myeloid cell will release the beta lymphocyte stimulator will bind with the normal cells and beta cells and autoreactive cells. And in normal cells, they convert into immunoglobulins. But in autoreactive cells, they convert into auto antibodies, leads to inflammation. This drug will inhibit the solubilized beta lymphocyte stimulator and reduce the beta lymphocyte receptors and signaling. These cells will undergo apoptosis, and there is a decrease in the number of beta cells and lead to use to treatment of the lupus nephritis. They mainly inhibit the action of the autoreactive or pro-inflammatory beta cells, which causes the chronic inflammation and damage of the cells. And this drug can be given as infusion or the self-injection. In infusion, they take 1 hour and can be repeated every 4 weeks. Injection, they are given to the skin and every week. These drugs will give an hope for the treatment of the lupus and lupus nephritis. The parameters of the this drug for 10 mg for kg in populations, about distribution of half-life is about 1.75 like this. These parameters are mentioned here. The side effects are carried out communicated by my friend teammate Nandini. The common side effects of belimumab include infusion-related reactions like fever, chills, and nausea during the intravenous infusion. Increased risk of infections like belimumab can weaken the immune system, making patients more susceptible to infections like respiratory and urinary tract infections, fatigue, and headache. Gastrointestinal issues like nausea and diarrhea. Injection site reactions for subcutaneous administration. Drug interaction along with belimumab drugs, the immunosuppressive agents, MS, and causes various side effects like gastric ulcers, infections, etc. Programs like National Lupus Advocacy Summit planned on upcoming May 2025. Central Florida Lupus and Youth Empowerment Conference held on August 3rd, 2024. World Lupus Day held on May 10th. Lupus Research Alliance events, health awareness programs, improving diagnostics tools, access to treatment and healthcare service, patient support programs.
About this drug in US, this drug indicates the treating used for the treating SLE and lupus nephritis patients aged above 5 years and older who are receiving standard therapy. But in Europe, this drug is used to treat SLE or lupus nephritis only for the adults, and this drug is not preferred or used for the CNS lupus, and it is not recommended for that situation. And at last, I want to conclude is SLE associated kidney complication, particularly lupus nephritis, represent a significant clinical challenge, and timely diagnosis and individual treatment and ongoing monitoring are crucial to migrate the kidney damage and improve the prognosis of the affected individuals. Thank you, sir.
Thank you, both of you. And I would love to ask judges if they have any suggestions or questions.
Well, nothing from my side here.
Okay, sir. Participants, do you have any questions? No, so I will consider it as no, and let's move to the next participant. I would love to, please, I will like if you can stop sharing your screen. Okay, now I would like to call A Nandini. A Nandini, are you on the board, please? A Nandini, are you on the board? Okay, she's not available. So
Have you checked Varad if she's there or not? I think
Yes, I checked. She's not there.
she's not there, sir. Yes.
उसके अलावा कोई और जो है जॉर्ज अटेंड नहीं किया apart from her.
Sir, actually, Durga Shri requested that she'll be presenting at the last due to technical issue. If she is there, we can go with her, sir.
Perfect, ठीक है. Then ठीक है, it's fine.
Durga Shri, are you there?
Yeah, ma'am. Am I audible?
Yes, you're audible.
Okay, ma'am.
You can start your presentation by sharing your screen.
Yeah, ma'am. Is it visible, ma'am?
Yes, it's visible.
Yeah. So, good afternoon to all. My topic here is shaping the. Excuse me. 1 second. Okay. My topic is shaping the future of healthcare, the emerging technologies in pharmacy. So, here only pharmacists are involved in dispensing the medicines and for the formulations of medicines. Now we have been entered into various fields. We have also used artificial intelligence in pharmacy. Artificial intelligence is being used in vast sectors. Now it has also found its emergence in healthcare sector. Artificial intelligence, in simple, refers to the use of computer system capable of performing tasks like making decisions, solving problems, improve its performance over time. So, artificial intelligence driven fields in pharmacy include hospital pharmacy. In hospital pharmacy, it is being used in medication therapy management, which could ensure that the patient follow their medication properly, which is called medication adherence, and to detect the adverse drug reactions to design the proper treatment plan and in the management of the chronic conditions. Then it is also used in the drug discovery and the development. In the drug discovery, it is used for the identification of the target, and for the personalized medicine, it uses the pharmacogenomics, which can be used to design the medication based on the patient's genetical information. And telepharmacy. I have chose telepharmacy as a separate topic because in the last few years, that is after the COVID situation, telepharmacy is being growing in a faster rate. Telepharmacy is nothing but the delivering the pharmaceutical care and services through the telecommunication technologies, which involves consultation of the patient on a remote basis, which does not involve the on live presence of the patient to the doctor, and remote prescription verification, remote patient counseling.
In the recent days after the COVID-19 pandemic, telepharmacy has been grown significantly. A report from the National Community Pharmacist Association shows that in 2020, over 40% of the community pharmacists offered telepharmacy services, allowing the patient to consult with the pharmacist randomly. So, as the graph represents that, it shows a comparison of the telepharmacy visit by the patient in the year 2019 and 2020. We can see that the COVID situation has abruptly shown its outburst in the month of April 2020. And yeah, there is the cases of televisit of the patient increased in the month of April 2020, and it's significantly been rising from then. And digital therapeutics. Digital therapeutics is a software-based tools that help the patient to manage, prevent, and treat medical conditions. So it is a software-based treatment that uses evidence-based interventions, which is nothing but the planned procedures or treatment that can aim to improve the person's health or well-being. And it is also used to prevent and manage the medical conditions. It uses tools like apps, sensors, virtual reality to help patient change their behavior. Some of the examples of digital therapeutics include for addiction, for opioid addiction, peer therapeutics is being used, which could help to change their behavior towards the opioid addiction or smoking addiction. For diabetes, insulia is used, which provides personalized recommendation of the insulin dose and coaches the patient to better manage their disorder. For anxiety and depression, Appify Health is used, which includes science-based activities and games to overcome the negative thought and personality test to discover their strength. For some other thing else, better therapeutics is being used. Digital therapeutics is nothing but the evidence-based disease-specific therapies that are tested in the clinical trials. Some require prescription. Actually, for all the digital therapeutics to be used by the people, they should be regulated by the FDA as a software as medical device. The digital therapeutics usually requires prescription from the licensed practitioner. Disease management apps. These are the apps which are used to manage the chronic diseases and to check the progress of their disease and symptoms over time. Companion apps, which are being used along with the pharmaceuticals or in a patient care to improve the treatment efficacy and to ensure the adherence to the medication. Wellness app, like it is used for the it is used to check the fitness of the patient, nutrition, or other self-direction wellness. The following graph shows the growth of the digital therapeutics used in the global market. And yeah, in the conclusion, as we know, the AI is being used in most of the sector now. Its use in the healthcare sector is also improving on a daily basis. So in the future, we can expect AI to be used more popularly in the healthcare also. Yeah, thank you.
Thank you, Durgashri. Now I would love to move towards the judges and the participants to ask the question, as this is our last presentation. Judges, participants, any questions?
I don't have any questions.
No, dear.
Okay, sir. So now it's time to wrap up the session. I would like to call Vasanti for the vote of thanks.
Yeah. A very good afternoon to everyone. On behalf of entire SCRMP team Pharmacy Wing, I would like to extend my heartfelt gratitude to each and every of you for making this poster presentation competition a resounding success. Firstly, I want to express my sincere appreciation to all the 27 plus participants present over here who dedicated their valuable time and efforts to share their insightful thoughts and research findings with us today. Your presentation were truly inspiring and showcased the incredible talent and dedication within our community. I would like also to thank our esteemed judges, Mohammad Gayur Khan sir, who is the General Secretary of SCRMP, Dr. Swapnanil sir, and also Dr. A. Satish Chandra sir for their valuable time and expertise in judging the competition. Your insightful feedback will undoubtedly help our participants grow and improve further. So thank you so much, judges. And a special thanks to our SCRMP CEC team, who the support was instrumental in making this event possible. Finally, I would like to thank the SCRMP team for their tireless efforts in organizing from initial planning to final execution and their hard work. Thank you all once again for your participation and making this event a memorable one. I would look forward to many successful events in future. And I would like to announce that the winners of this competition and also the creative reels competition will be announced post webinar session. Thank you.
Thank you, Vasanti. Now let's move towards the introduction of SCRMP. So I would love to introduce our organization to our dear participants. This yeah, sorry. So let's begin. Let me introduce to our society. The SCRMP stands for the Clinical Society of Clinical Research and Medical Professionals, and we are proud to organize this session. It is established in 2024 and headquarters in Telangana, India. SRMP is more than just an organization. It is a thriving community of healthcare professionals, researchers, and students dedicated to advancing clinical research and improving patient care globally. Recognized under the Society Act 2001 and by Niti Aayog, SRMP is committed to foster innovation, collaboration, and education in the field of life science industry. By becoming a part of SCRMP, you you can gain access to world opportunities like exclusive webinars in the fields like pharmacovigilance and medical writings, free manuscript publications in regarded journals, educational resources, and webinars tailored for professional development, networking opportunities with leading expert researchers and organizations in clinical research. Joining SRMP is not just about being part of an organization, it's about stepping into a platform where your ideas, ambitions, and efforts meet the tools and networks to bring them to life. Whether you are a student looking to explore career paths, a researcher eager to collaborate, or a professional starving for excellence, SRMP is here to help you and support your journey. This is your chance to make a difference, be a part of movement shaping the future of healthcare and clinical research. Together, we can drive change, make discoveries, and enhance lives across the globe. Visit our website or connect with us after the session to learn more about options and benefits. Let's grow, innovate, and succeed together with ACRMP. Thank you. I request all the participants, please fill the feedback form that has been shared with you in the chat section of this Zoom meeting, so we can know your feedback and develop ourselves. And one more announcement, that at 3 p.m. today itself, we are releasing our Health Kingdom magazine on our social media accounts like LinkedIn and Instagram. So I request everyone to stay tuned with us to read the magazine and increase your professional life. Thank you. The winners of this competition will be declared after the webinar that has been arranged in the evening, and I officially declare that this session has been completed. Thank you for your participation. You can leave the meeting. Thank you.
1 second, guys. 1 second. Hello.
Okay.
Yes, sir.
Yes, sir.
Uh, don't leave the meeting. 1 second. Actually, I want to add something. Guys, whatever you have presented today, poster presentation, आपका जो भी abstract है, whatever you have drafted poster presentation, some people has joined, they are in first year. आप लोग first year में थे. I understand आप लोग learning phase पे हो. Then you also have to draft a poster or abstract, whatever you understand. So I will give you instruction in group. आप लोग एक अपना एक abstract बनाओ, and that abstract will publish in our official conference proceeding book with ISBN number. That will be useful, and you can also put that number with the title, and so that will be useful in your CV and in the future research community as well. That will be useful. So you will get, as per the UGC norms, for book chapter or for abstract and conference proceeding, you will get 5 points, which is equivalent to 2 review articles. So that's it. I want to let you know. So just submit your abstract as soon as possible, so we can publish your abstract book on time. That's it, guys.
Sir, there is a question.
Yes, please.
Sir, the abstract you were saying to submit, the poster we are presenting today, only that abstract we have to submit, or
Yes,
another abstract?
dear. That abstract only.
Okay, sir.
Yes, yeah. As soon as possible, I'm expecting, because we have to publish a conference proceeding, and once we have the conference proceeding, you can also add those details in your CV. That will be useful, because attending the poster presentation, attending the oral presentation, that is not only the way where all other people is doing nowadays in India, but you will have some evidence, right? Like आपने अगर कहीं पोस्टर प्रेजेंटेशन किया या ओरल प्रेजेंटेशन किया, आपको भी कोई एविडेंस देना पड़ेगा. So that's why we have implemented this ISBN number and conference proceeding part through our society. So it's like evidence, and आपके लिए भी useful होगा आपकी scientific journey and professional journey में, and you will get some insights as well in future.
Okay, sir. Thank you.
Thank you, guys. And जिसको भी कोई doubt है, if you are in first year, just drop your queries in group. I'm 100% sure SCRMP members will help you, and your queries will resolve within one day. Thank you, guys, everyone. Thank you. You can leave now.
Yes, again, I
Just
participate.
one second.
Okay.
Yes, कुछ points मुझे add करना है. Yes, very good afternoon, guys. सबसे पहले आप सबको प्रेजेंटेशन देने के लिए कॉन्ग्रेचुलेशन. मैं समझती हूँ कि ये आपका पहला एक्सपीरियंस था. लाइक बहुत सारे जो स्टूडेंट्स थे उनका आज पहली बार था, और पहली बार हर किसी को लाइक कुछ गलतियाँ होती है जो बिल्कुल नॉर्मल चीज़ है. लेकिन ये गलतियाँ आपको सीखने का मौका देती है, और मैं चाहती हूँ कि आप के एक्सपीरियंस को एक लर्निंग अपॉर्चुनिटी के तौर पर देखें. जैसे कि जब आप प्रेजेंटेशन दे रहे होते हैं तो ये सिर्फ कंटेंट नहीं होता है, बल्कि ये आपकी रिसर्च, आपके एफर्ट्स और कॉन्फिडेंस का कॉम्बिनेशन होता है. आपको लाइक आप जो सीखते हैं वो आपको फ्यूचर में ज़रूर मदद करेगा. तो ये समझ के अगले टाइम बेहतर काम करने की कोशिश करना. और मैं थोड़े से आपको टिप्स देना चाहती हूँ जो आपको अपनी प्रेजेंटेशन को बेटर बनाने में मदद करेगा. जैसे कि पहली चीज़ ये होती है कि रिसर्च एंड एक्सप्लोरेशन. जब आप किसी टॉपिक पर काम कर रहे होते हैं तो सिर्फ सरफेस लेवल इंफॉर्मेशन मत ढूंढना. जैसे आपको डीप रिसर्च करनी होती है ताकि आपको उस टॉपिक के बारे में हर मतलब एंगल से पता हो. जैसे कि एग्जांपल तौर पे देख लिया जाए कि मान लीजिए डायबिटीज एंड इट्स मैनेजमेंट पर प्रेजेंटेशन दे रहे हैं. अगर आप सिर्फ बेसिक इन्फॉर्मेशन जैसे डायबिटीज क्या होता है मतलब पर रुक जाएंगे तो आपका कंटेंट है ना इनकम्प्लीट होगा. लेकिन अगर आप उसके ट्रीटमेंट ऑप्शन, लाइफस्टाइल चेंजेस और लेटेस्ट जो रिसर्च फाइंडिंग्स है उसके बारे में पढ़ते हैं तो आपका जो कंटेंट होता है ना बहुत इंफॉर्मेटिव और एंगेजिंग होगा. और दूसरी एक और ये पॉइंट्स होता है कि जो गाइडलाइंस का ध्यान रखना होता है. जैसे कि हर प्रेजेंटेशन के साथ कुछ स्पेसिफिक गाइडलाइंस होती है जो आपको फॉलो करनी होती है. जैसे अगर आप उन गाइडलाइंस को समझकर इम्प्लीमेंट करेंगे तो आपकी प्रेजेंटेशन को प्रोफेशनल दिखाई देंगी. जैसे कि एग्जांपल अगर पोस्टर प्रेजेंटेशन के लिए साइज या फॉर्मेट की कोई रिक्वायरमेंट हो तो उसका ख्याल रखना. अगर गाइडलाइंस में बोला हो कि आपको 2 to 3 इमेजेस यूज करनी है और उसको 500 वर्ड्स का डिस्क्रिप्शन देना है तो उनको फॉलो करके ही पोस्टर को डिजाइन करें. जैसे कि गाइडलाइंस को इग्नोर करना आपके एफर्ट्स को वेस्ट कर सकता है. और मेन इंपॉर्टेंट चीज एक ये सेल्फ कॉन्फिडेंस और क्लैरिटी. जब आप आपकी बात रखते हैं तो सेल्फ कॉन्फिडेंस बहुत जरूरी है. अगर आप अपने आइडियाज को कॉन्फिडेंटली प्रेजेंट करेंगे और ऑडियंस को भी आपको सीरियसली मतलब जब आप खुद कॉन्फिडेंटली सारी चीजें प्रेजेंट करेंगे तो ऑडियंस भी आपको सीरियसली लेंगी. जैसे कि अगर आप कॉन्फिडेंटली अपने टॉपिक्स के बारे में बात करते हैं और क्लियर पॉइंट्स को प्रेजेंट करते हैं तो आपका मैसेज ज्यादा इफेक्टिव ऑडियंस तक पहुंचेगा. अगर आप नर्वस फील करते हो और अनक्लियर लैंग्वेज यूज करते हो तो आपका जो कंटेंट है ना वो मिडल लग सकता है. तो ये सारी जो मिस्टेक्स होती है ना तो इसको थोड़ा-सा अवॉइड करना और नई नई चीज़ उसके अंदर ऐड करने की कोशिश करना. और एक चीज़ आप बिल्कुल भी ऐसा मतलब अकेला फ़ील नहीं करिएगा क्योंकि एससीआरएमपी की टीम हमेशा आपकी मदद के लिए है. जैसे कि अगर आपको किसी भी चीज़ में हेल्प चाहिए, जैसे कंटेंट की क्लैरिटी, स्ट्रक्चर या प्रेजेंटेशन स्किल्स जो हम आपको गाइड करेंगे. एग्जांपल अगर आपको ये नहीं पता है कि प्रेजेंटेशन किस तरह से लाइक किस तरीके से ऑर्गेनाइज़ करनी चाहिए. एग्जांपल लाइक इंट्रोडक्शन, मेन बॉडी, कंक्लूजन तो हम आपको स्टेप बाय स्टेप गाइड्स दे सकते हैं. जैसे स्टार्टिंग विथ हुक फॉलोड बाय की पॉइंट्स एंड एंडिंग विथ स्ट्रॉन्ग कंक्लूजन. तो ये सब याद रखिए. अगर हर गलती एक सीखने का मौका होती है. अगर आप अपनी मिस्टेक से सीख कर नेक्स्ट टाइम पर और बेटर प्रेजेंटेशन देने की कोशिश करेंगे, तो आप अपने गोल्स को ज़रूर अचीव करेंगे। तो हर चैलेंजेस एक अपॉर्चुनिटी होती है, आपको अपनी एबिलिटीज़ पर पूरा भरोसा रखना होगा। अगर अपने अपने एफर्ट्स को सही डायरेक्शन में लगाया, तो आप ज़रूर अपने सपनों को पूरा कर सकते हैं। और आपको अगर और कोई भी किसी भी तरह की मदद ज़रूरत हो, चाहे वो कंटेंट हो, प्रेजेंटेशन हो या कोई और गाइडेंस हो, तो मैं और मेरी टीम आपके साथ है और हम सब मिलकर आपकी मदद करेंगे ताकि आप अपने पोटेंशियल को पूरा और एक्सप्लोर कर सकें। और आप सबको मेरी तरफ से बेस्ट ऑफ लक। थैंक यू गाइस।
Thank you, Sumaya. Now I again announce that our magazine Health Kingdom is been releasing at 3 p.m. today itself. Please, I request everyone to stay tuned with our social media handles, and they can now leave the meeting. Thank you, everyone.